In medical terms, high blood sugar is known as hyperglycemia. It is associated with diabetes and prediabetes. Prediabetes is when your blood sugar is high but not high enough to be classified as diabetes. Our body normally able to control blood sugar level by producing a hormone known as insulin. Insulin help your cells to use the circulating sugar in your blood. When there is no extra sugar left in your blood, there is no harm it can cause. That's why insulin is one of the most important blood sugar regulator. However, there are many factors that can cause high blood sugar. Some of them are external factors while some of them are internal. External factors include food choices, stress, certain medication, and a sedentary lifestyle. Hey viewers, I am Dr. Ali. In this video, I am going to tell you some easy and effective ways to lower your blood sugar quickly. Before moving any forward, subscribe to the channel, like the video, and watch the video to the end. Now, without any further delay, let's get into it. If you have high blood sugar and need to lower it fast, try these following methods. Number 1. Take your prescribed insulin. When your blood sugar level gets too high, the quickest way to reduce it is to take fast-acting insulin. Exercising is another fast and effective way to lower blood sugar. When insulin levels are low, your blood sugar raises too fast and can lead to diabetic ketoacidosis. In this condition, you should go to the hospital instead of handling it at home. Symptoms of ketoacidosis are shortness of breath that smells like fruits, nausea, vomiting, and a very dry mouth. If you are not sure what to do, call your doctor and ask him about how much rapid-acting insulin you should administer when your blood sugar spikes. You should check your blood sugar about every 20 to 30 minutes after taking insulin to make sure it is working. Number 2. Exercise regularly. Regular exercise can help you reach and maintain a moderate weight and increase insulin sensitivity. Increased insulin sensitivity means your cells can more effectively use the available sugar in your blood. Exercise also help your muscle use blood sugar for energy and muscle contraction. Light exercise are strongly recommended by doctors to lower blood sugar. You can do these exercises for just a few minutes throughout the day. Some of the recommended light physical activities are cycling, walking, cooking, vacuuming, gardening, dancing, and swimming. In fact, any activity that regularly gets you up and moving regardless of the intensity can beat the diabetes. Number 3. Lower your daily carb intake. Counting carbohydrate or keeping track of the carbs in all your meals, breakfast, snacks, and drinks can help you manage your diabetes. Many people with diabetes count carbs to make managing blood sugar easier, which can also help them stay healthy, feel better, and improve their quality of life, prevent or delay diabetes complications such as kidney disease, eye disease, heart disease, and stroke. Many studies also show that eating a low-carb diet helps reduce blood sugar level and any other diabetic-related problem. It is important to note that low-carb diets and no-carb diets are different. You can still eat some carbs when monitoring your blood sugar. Number 4. Eat more fiber. Fiber should be a part of healthy diet as it provides a range of health benefits. It can be especially important in managing diabetes. Our body is unable to absorb and break down fiber. This is the reason it doesn't cause a spike in blood sugar in comparison to the other carbs. There are two types of fiber, insoluble and soluble. While both are important, soluble fiber has been shown to improve blood sugar, while insoluble fiber has not been shown to improve blood sugar. A high fiber diet can improve your body's ability to regulate blood sugar and minimize blood sugar loss. This could be especially helpful in managing type 1 diabetes. According to a 2018 study published in the Journal of Chiropractic Medicine, fiber can also prevent diabetes. Studies have found that high fiber diet can reduce the incidence of type 2 diabetes by 15 to 20% compared to low fiber diet. Foods high in fiber are peas, lentils, chickpeas, black beans, chia seeds, almonds, broccoli, sweet potato, raspberries, pears, and apples. The recommended daily intake of fiber is about 25 grams for women and 35 grams for men. Number 5. Drinking enough water. Drinking a lot of water is an easy and effective way to control your blood sugar level. The idea is that water helps flush glucose out of the body. A study found that people who drank less than half liter of water per day were at increased risk of developing high blood sugar. In addition to preventing dehydration, water helps flush out toxins and any excess sugar through urine. Keep in mind that water and other zero-calorie drinks are best. Avoid soda and other sugar-sweetened options as these can raise blood sugar, drive weight gain, and increase the risk of heart disease. Number 6. Avoid eating large meals. One way to keep carbs under control is by eating in moderation. Feeding your body throughout the day helps regulate your blood sugar levels and prevent any highs and lows. Eating small meals throughout the day can help you regulate your calorie intake and maintain a moderate weight. Consequently, weight management promotes healthy blood sugar levels and has been shown to reduce the risk of developing type 2 diabetes. Monitoring your serving sizes also helps prevent blood sugar spikes. Here are some helpful tips for managing large meals. Eat slowly, use small plates, read food label, and check serving sizes. Number 7. Get enough quality sleep. Poor or limited sleep affects body chemistry, and getting enough sleep feels excellent and is necessary for good health. According to a study published in 2015, healthy volunteers who sleep only 4 hours for 3 nights had higher level of fatty acids in their blood, which reduced insulin ability to regulate blood sugar by about 23%. In fact, poor sleeping habits and a lack of rest can affect blood sugar levels and insulin sensitivity, increasing the risk of type 2 diabetes. This habit can also increase appetite and promote weight gain. Adequate sleep is about both quantity and quality. The National Sleep Foundation recommends that adults should get at least 7 to 8 hours of high quality sleep per night. To improve the quality of sleep, try to follow a sleep schedule, avoid alcohol and caffeine after 3 p.m., cut down on screen time before bed, limit your naps in daytime, get regular exercise, create a bedtime routine, and avoid working in your bedroom. Number 8. Choose food with a low glycemic index. The glycemic index measures how quickly carbs break down during digestion and how rapidly your body absorbs them. On a scale of 0 to 100, low glycemic index foods have a ranking of 55 or less. Both the amount and type of carbs you eat determine how a food affects your blood sugar level. Eating low glycemic index food has been shown to reduce blood sugar level in people with diabetes. Some of the low glycemic foods are cucumber, tomatoes, carrots, celery, cauliflower, asparagus, lentils, chickpeas, milk, oats, kidney beans, eggs, and nuts. Number 9. Try to lower your stress level. According to the Diabetes Teaching Center at the University of California, when you are stressed, insulin level falls, certain hormone rise, and more glucose is released from the liver, which ends up in the bloodstream and can cause disruption in blood sugar for up to 8 hours. Taking a few deep breaths, going for a walk, playing with your dog for a few minutes, listening to your favorite song, anything which distracts you for a few minutes will help in lowering blood sugar level. One study including a group of students showed that exercise and meditation significantly lower stress and blood sugar. Exercise and relaxation method like yoga may also help correct insulin secretion problems among people with diabetes. Number 10. Maintain a moderate weight. According to the National Institute of Diabetes and Kidney Disease, carrying around extra weight is one of the main causes of insulin resistance. As told before, insulin is a hormone which reduces blood sugar. A study published in the American Journal of Preventive Medicine found that losing 5 to 10% of body weight resulted in improved insulin sensitivity and glucose tolerance. For example, if a 90 kg person lost 5 to 6 kg weight, they may see significant improvement in their blood sugar level. Number 11. Eat prebiotic rich foods. Prebiotic foods are high in a special type of fiber that support digestive health. They promote growth of friendly bacteria in gut, help with various digestive problems, and even boost your immune system. Prebiotic foods have also been shown to improve metabolic rate and blood sugar level. Studies have found that improvement in blood sugar level are more significant in people who consume multiple species of prebiotics and for at least up to 8 weeks. Some of the prebiotic rich foods are chicory roots, garlic, onions, chickpeas, lentils, beans, bananas, apple, oats, and almonds. Number 12. Never skip eating breakfast. We have all heard that breakfast is the most important meal of the day. This is especially true for those who have diabetes. Researchers found that skipping breakfast once a week is associated with a 6% higher risk of developing type 2 diabetes. If you are a diabetic, choose a high protein breakfast over a high carbohydrate breakfast. Some of the diabetic friendly foods are eggs, leafy green vegetables, fatty fish, chickpeas, beans, lentils, unflavored yogurts, nuts, paneer, meat, and popcorn. Number 13. Eat healthy snack frequently. Spreading your meals and snacks throughout the day may help you avoid both high and low blood sugar levels. Healthy snacking between meals may also reduce your risk of type 2 diabetes. Several studies also suggest that having smaller, more frequent meals throughout the day could improve insulin sensitivity and lower blood sugar level. Number 14. Add these specific foods to your diet. Many foods and plants are known to have medicinal properties. However, the overall quality of evidence on these foods is low due to insufficient human studies or small sample size. Therefore, no conclusive recommendation can be made regarding their use. But because these foods are very healthy, let's just talk about them. Number 1. Apple cider vinegar. According to some older research, apple cider vinegar may reduce blood sugar levels by delaying digestion of food. Number 2. Cinnamon. This spice may improve blood sugar levels by enhancing insulin sensitivity and breakdown of your carbs. Number 4. Fenugreek seeds. There is some evidence that suggests fenugreek seeds may help in blood sugar management.